Itraconazole, sold under the brand name Sporanox, is a medication used to treat a variety of fungal infections. It is classified as an azole antifungal and works by stopping the growth of fungi. Sporanox can be used to treat fungal infections in the lungs, mouth, throat, esophagus, and other organs. It can also be used to treat fungal infections in the nails. The dosage and length of treatment with Sporanox will depend on the type of infection being treated. It is important to take this medication exactly as prescribed by your doctor. Sporanox is usually taken once or twice a day with food. It is important to take Sporanox at the same time each day to maintain a consistent level of the medication in your body. Be sure to follow your doctor's instructions and do not stop taking Sporanox without consulting your doctor, even if you start to feel better. Before you start taking Sporanox, be sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with a full meal as directed by your doctor, usually once or twice daily. Swallow the capsules whole. Take Sporanox 2 hours before or 1 hour after antacids. Antacids may decrease the absorption of this medication. Also, take this medication with an acidic drink, such as cola, if you have decreased or no stomach acid or if you take drugs that decrease stomach acid. The dosage and length of treatment are based on your medical condition and response to treatment. Take this medication exactly as prescribed by your doctor. For the best effect, take this antifungal at evenly spaced times. To help you remember, take this medication at the same times every day. Continue to take this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. The different forms of Sporanox deliver different amounts of medication and may be used for different purposes. Do not switch between the different forms or brands of this drug without your doctor's direction. Tell your doctor if your condition does not get better or if it gets worse. Side effects of Sporanox may include nausea, vomiting, diarrhea, headache, stomach upset, or dizziness. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, you should tell your doctor right away if you experience any serious side effects such as numbness or tingling of the arms or legs, hearing loss, or mental/mood changes like depression. Itraconazole has the potential to cause very serious, possibly fatal liver disease. Contact your doctor immediately if you develop symptoms of liver disease, such as nausea or vomiting that doesn't stop, loss of appetite, stomach or abdominal pain, yellowing of the eyes or skin, or dark urine. It's common for itraconazole to cause a mild rash, but there is also a rare rash that could be a sign of a severe allergic reaction. Seek medical help immediately if you develop any rash. While a very serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling of the face, tongue or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you have a history of heart failure, do not use itraconazole to treat fungal nail infections. It may rarely cause or worsen heart failure. Tell your doctor right away if you develop symptoms such as shortness of breath, swelling ankles/feet, unusual tiredness, or unusual/sudden unexplained weight gain. This medication can slow down the removal of other medications from your body, which may cause very serious, possibly fatal, side effects to occur. Examples of affected drugs include certain blood thinners, such as ticagrelor, colchicine, certain drugs to treat irregular heartbeat, such disopyramide, dofetilide, dronedarone, quinidine, eplerenone, ergot alkaloids, such as dihydroergotamine, ergotamine, methylergonavine, felodipine, fesoterodine, irinotecan, ivabradine, lurasidone, methadone, midazolam, nisoldipine, pymazide, ranolazine, certain statin, cholesterol drugs, such as levastatin, simvastatin, solifenacin, telithromycin, triazolam, among others. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Before taking Sporanox, make sure to inform your doctor or pharmacist about any allergies you may have, especially to other azole antifungals. It's important to discuss any medical history you have, including liver disease, kidney disease, heart disease, lung disease, or stomach acid issues. It's important to note that Sporanox may cause dizziness, and using alcohol or marijuana can increase this effect. It is advised to avoid driving or using machinery until you know how Sporanox affects you. Alcohol consumption should be limited, and it's recommended to talk to your doctor if you use marijuana. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and herbal products you are using. For older adults, there may be a greater risk of hearing loss while using Sporanox. For pregnant women, it's important to use this medication only when clearly needed and under the guidance of a doctor, as it may harm an unborn baby. It should not be used to treat fungal nail infections if you are pregnant or could become pregnant during treatment. Women of childbearing age should start this medication 2 to 3 days after the start of their periods to ensure they are not pregnant. Reliable forms of birth control should be used while taking this medication and for 2 months after stopping treatment. It is also important to consult your doctor before breastfeeding while using Sporanox, as it can pass into breast milk. When taking Sporanox, it's important to be aware of potential drug interactions. This medication may interact with other drugs, which could change how it works or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Itraconazole, the active ingredient in Sporanox, interacts with many medications. Other medications can also affect the removal of itraconazole from your body, which may impact how it works. Some examples of these medications include efavirenz, isoniazid, nevirapine, rifamycins, such as rifabutin, and certain drugs used to treat seizures, such as phenytoin. Be sure to discuss any potential interactions with your healthcare provider before starting Sporanox. If someone has taken too much Sporanox and is experiencing severe symptoms like losing consciousness or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to act quickly in these situations. It's important not to share Sporanox with others, as this medication has been prescribed specifically for your current condition. It should not be used later to treat or prevent another infection unless your doctor advises you to do so. Before starting this medication and while taking it, you may need to undergo lab or medical tests, such as liver function tests. It's crucial to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Sporanox, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at the usual time. Do not take a double dose to make up for the missed one. It's important to store Sporanox at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it by consulting your pharmacist or local waste disposal company. And remember, don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.